Well, it is Wednesday, and that means it's time for Morning Rounds.
That's right. Dr. Thomas Bosshardt joins us this morning. Tom, it's great to have you. And we're here to talk about robotics in the surgery room, right?
Right, yeah. We're very excited at Marian Medical Center. We've now acquired the Vinci robotic surgical system for our community, and I'm here to talk about that.
Very cool. Well, tell us a little bit about what it does, because, you know, it sounds very high-tech and very futuristic. Tell us about it.
Certainly. Most people, when they hear about robotic surgery, they're fearful that we're just sending a robot into the operating room to do the surgery. But
I think that's the big fear.
You're right.
I'm here to guarantee you that's not what's going on. It's a very advanced, high-tech instrument that actually the surgeon guides to perform the operation, and through the use of the robotic technology, we're able to perform complex operations through very small incisions, and there's a lot of benefit to that.
Okay, and let's talk about some of those benefits. One of the ones that stood out to me, the less chance of infection when you're talking about post-surgery and the recovery process.
Right.
Can you tell us a few more benefits?
Right. Many of the more complex operations traditionally have been performed through longer incisions. I'm talking about abdominal surgery, like colorectal surgery or hysterectomies or prostatectomies. Longer incisions, and with longer incisions, there's more chance of wound infections. There's also more pain for the patient, longer scars. Longer recovery time. So one of the benefits to the patient of the robotic system is that we can perform the surgery through very small incisions, and these are generally in the neighborhood of a quarter to a half inch. So by utilizing the small incisions, there's less chance of infection, less pain for the patient, quicker recovery.
And what kind of surgeries are we talking about? What kind of operations?
Well, the Da Vinci system was introduced about 10 years ago, and it's slowly been becoming more popular across the country and across the world. And initially it was utilized for prostatectomies, for prostate cancer, by urologists. And now it's being utilized by gynecologists for hysterectomies and other GYN procedures. I'm utilizing it for colorectal procedures. It can be utilized in the chest for lung resections. Heart surgeons have utilized it to do cardiac procedures. So there's many more operations now. So at Marian, it's being utilized by urologists, the gynecologists, and the general surgeons.
Very cool.
Wow.
That's even possible. And so what does that mean? I know Marian Medical Center, it seems like we've definitely seen a big increase in some of the technology that's used there. What does it mean for people here on the Central Coast?
Well, of course, we're very excited about it. It means that the most advanced technical surgical systems are now available here. Patients will no longer need to travel down to UCLA, USC, Stanford for some of these procedures. They can have them done right here in Santa Maria. So we're real excited to bring that to the community and our patients here.
Absolutely.
And how has your use been with it? I mean, was there a kind of a learning curve as you have to learn new procedures and that kind of thing?
Right. These are procedures that have been performing for over 10 years. So it's just a new technology. But there is a training program that we go through that's rather intense. So I've been doing all of these procedures, but now I have the benefit of the robot to assist me. So I'm excited about it.
Absolutely. And so at this point, have you done several surgeries with the technology? Have you seen patients return? Have they had, you know, good feedback as well? Yeah,
we started doing the operations last month, and we've done some gynecologic procedures, urology procedures, and I've done a couple general surgery procedures, and patients have done well with it. So yeah, we're excited. We feel we'll probably have at least 10 surgeons on board utilizing this within the next month or two, and we hope to have even more. And we hope that it's being used on a daily basis.
Okay, and again, it's called the Da Vinci. Why? What is the reason behind the name there?
Well, the company that developed it, Leonardo da Vinci, was obviously a very brilliant person, and one of the things that he did among his many contributions was to develop the first robot. And this is really the first robotic surgical system worldwide, so the company chose his name.
Wow. Well, very cool.
Yeah,
very interesting stuff, and good to have you on to explain it, because as we said at the very beginning, when you hear the robotics technology in the ER,
people tend to perk up a little bit.
Right.
What? What's going on?
Right.
Dr. Tom Bosshardt, thanks so much for joining us.
You're welcome. Thanks for having me.
All right, and we'll be right back. If you have any questions for Dr. Bosshardt or just general health questions, morning rounds at kcoy.com, and of course we'll get those answered for you. And thank you again for joining us. We'll be right back with another check of your forecast.